name's Vanessa Baker. I'm a nurse practitioner student here with Youngstown State University. Can I get your name?
Zach Baker.
Okay. All right, Zach, so you are here today for a head, ears, nose, and throat assessment. We are going to get started with that. So looking off at your head, I can see that you are holding it in a good symmetrical upright position. No tremors. I notice that your facial features, your eyes, eyebrows, mouth, and nose, everything is symmetrical and appropriate shape. I'm going to palpate your scalp for any lesions, depressions, or lumps. Let me know if any of this is tender.
Nope.
Okay. All right. So then I can see that your scalp moves freely with no pain as well. I'm noticing that your hair is shiny. It is not brittle. Go ahead and look down for me. There is no bald or thick patches, no scaliness, no dryness. With your skin, I can see that your skin is an appropriate pink color. It is warm to touch. I don't notice any lesions. No lesions noted. No signs of injury. No odor is coming from you. You look well groomed. I can see that there is no discoloration. So I'm going to take a look at your nails if you can hold out your hands for me. So I note that your nail edges are smooth. They're round, pink with no discoloration. I can see that there is no separation with your nail bed. It is smooth and flat with no ridges or grooves, and your cuticles do not have any blisters. So go ahead, place your thumbs together like this for me. And then I note that you have the diamond shape, which there is no signs of clubbing. So we're gonna move on to your neck. So looking at you, I can tell that symmetrical, no bumps, no redness noted. Go ahead and look up for me. I see that your trachea is midline. Go ahead and look left. Go ahead and look right. Okay, so you have good range of motion. There is no shift in the trachea. I am going to palpate down to feel for your thyroid. So go ahead and look up slightly for me. So palpating down, feeling your thyroid, feeling the thyroid glands. There's no bumps, no tenderness. Go ahead and I'm going to have you take a drink from me. I'm going to go behind you here. So feeling for your thyroid and the thyroid glands. Okay, go ahead and take a drink. Okay, so I can note that there is smooth movement. It's symmetrical, and then no pain or tenderness with that.
Nope.
Okay. All right, and also then with the hyoid bone, I felt that it was smooth movement as well. So now I am going to listen for any bruit in the thyroid. So I will have you look up slightly. And then noting no bruit on either side. So now I'm going to palpate and feel for each of your lymph nodes. Starting here with your pre-auricle, there is no bumps going down and around to your post-auricle. And then I am going to come around to your submandibular lymph nodes, and then feeling the submental. And then I am going to go down to the pre-clavicle. And then I'm going to go to the post-clavicle, posterior, not feeling any lumps. Then I'm going to go to your subclavicular lymph nodes. Once again, feeling no lumps, no bulging, no redness is noting, and then no pain or tenderness with that.
Nope.
Okay. So then I am going to palpate your temporal mandibular joint. So go ahead and open and close. Okay. And then open and close. Okay. So feeling that it was smooth, no pain, no tenderness.
Nope.
Okay. All right. So then I am just going to, once again, auscultate and listen for any temporal bruits, which I hear none. and then none noted on that side. Okay. So now we're gonna move to the nose. Looking, I see that it's symmetrical, no lesions, no injury, no signs of bleeding or discharge. I'm going to palpate your frontal sinuses, so feeling no lumps, no tenderness with that.
Nope.
Okay. All right, so then I'm going to palpate on the maxillary. Once again, feeling no lumps, no bulges, any tenderness with that?
Nope.
Okay. All right, so then I'm going to now percuss. So let me know any tenderness.
Nope.
With that, okay. And then now I'm going to percuss for the maxillary sinuses. No tenderness.
Nope.
And no tenderness.
Nope.
Okay. All right. So I'm just gonna slightly have you look up, and I'm just gonna lift up and look at your nares, noting once again no drainage. I am now going to look into your nose. So I'll have you look up, seeing no redness, no polyps. The mucosa is nice and pink. Your septum is midline. The nasal turbulence are pink as well. So now I am going to look into your mouth. I'll have you open your mouth. Okay, stick out your tongue. Okay, noting that your tongue is symmetrical. There's no lesions, no injury, no bleeding. Your mucous membranes look nice and pink. No bleeding or swelling there. There was no deviation or tremor when you stuck your tongue out. Go ahead and open up again for me. I'm just stick out your tongue, okay? And your palate is intact, and then your uvula is midline. It seems that there's no tonsils present.
Nope.
And then this is where I would test for a gag reflux, but we will defer that for this time. Okay, so moving on to your ears, I can see that both your ears are symmetrical. They are pink and appropriate in color. They are both warm. So just palpating them, no pain, no tenderness.
Nope.
Not when I tug either of them.
Nope.
Okay. All right. So I am now going to look into your ears, and then I'm going to pull up and back, looking at the tympanic membrane, seeing that it is a pearly white and the bony prominences are present. No foreign bodies were noted, no injury, no drainage. So I'll have you look this way so I can look at this one. So pulling up and back. Once again, visualizing the tympanic membrane, seeing that it is pearly white, the bony prominences are present, and no signs of infection or foreign bodies as well. So now I will do some hearing tests. So the first one I'm going to do is the Weber test. So I'm going to place this in the center of your forehead and have you tell me when you hear the vibration in both ears.
Yep.
Okay. All right. So then now I'm going to do the rhyme test. So I'm going to place this on your mastoid and have you tell me when you can hear the vibration.
Yep.
Okay. And then now tell me when you cannot hear it.
Nope.
Okay. And then I will do the same for the other side. Tell me when you can hear it.
Yep.
Okay. And then when you can't.
Nope.
Okay. All right. So then I'm just going to do a whisper test. I'm going to step back a little bit. I'm going to have you close one ear, and then I'm going to whisper a word and just have you repeat it. Baseball.
Baseball.
Okay. And then close the other ear, and then repeat the word. Football.
Football.
Okay. So your hearing is appropriate as you are responding to all my questions appropriately. So moving on now to the eyes. Looking at them, I can see that they're symmetrical. There's no redness, no drainage noted. I'll have you open and close them. Okay. So seeing that they move together symmetrically, there's no drooping. Looking at your eyelids, I see no crusting, no redness, no flakiness. I am going to pull the bottoms of your eyelids down and have you look up, and I'm just going to assess your conjunctiva, seeing that it is white, no blood vessels present, and that your sclera is white as well. No drainage was noted. So There was also no triigium noted as well. So then I'm just going to palpate your lacrimal gland. There's no tenderness noted there.
Nope.
Okay, and then no enlargement, so that is good. So then I'm just going to look at your corneas. I'm just going to quickly flash the light over, making sure that once again, no blood vessels are present. So just look straight ahead. Okay, so nice and white and nice and white. Okay, so like I said, no blood vessels, no arcuus was noted. I can look and see that your irises are both the same color of blue. Your pupils are both round and 3 millimeter in size. And I'm just going to make sure that they're both reactive. Okay, and both pupils are equally reactive. I will now do accommodation. So I will have you look to an object further off, and then I am going to bring the pen light in and just make sure that your pupils constrict. Okay, and they did constrict. So then now moving to the corneal light reflex, I'm going to have you just kind of like look ahead, and I'm going to shine this light in the center, making sure that I can see the light reflex on both corneas. And I do. Okay, so that is appropriate. So then I'm going to do a cover-uncover test to assess your eyesight. I will have you cover one of your eyes and then just look at my nose. Okay, and then now cover the other eye and look at my nose. Okay, noting no abnormal movement, and they both responded well. So now I'm just going to do the 6 cardinal field of gaze test. So I will have you just look at my pen light and follow it, noting appropriate movement of each eye and no nystagmus noted. So that is good. And then, so for the visual acuity, I will just step back a little bit, and then if you could cover one eye and just read a line.
EPTZO.
Okay, and then cover the other eye and read a line.
EPTZO.
Okay. So eyesight is appropriate. So then I'm going to do your visual field. So I'm going to have you cover your right eye, and I am going to close my right eye, and I'm going to hold 3 fingers in each field, and you're just going to tell me what the number is. So
3.
Okay.
2. 1.
Okay. All right, now do the left eye, and then I'm going to close my left eye.
3.
Okay.
2.
Okay.
1.
Okay. All right. So your visual field is good. So then now I'm just going to assess further in depth your eye with the ophthalmoscope. Okay. So I will just have you look ahead, and with the left eye, I'm going to look at your cornea, seeing that it's nice and white, and then with your right, seeing that it's nice and white, I see the clear cornea, your lenses are clear, and then I'm going to check for the red reflex. So once again, just kind of look ahead, and I am going to note the red reflex and just follow it in, noting that the blood vessels are larger than the arteries, and that there's no AV nicking or cotton wool spots noted, and that the disc is pink and normal in color, and that the anterior depth is normal. And then I'm going to have you look directly into the light to assess your macula. So go ahead and look. Okay, noting that the macula is a nice yellow oval shape. So now I'm going to do the same on the right eye. Just go ahead and look ahead. And then I'm going to note the red reflex, following it in, noting that once again the blood vessels are larger than the arteries. There's no AV nicking noted or cotton wool spots noted. The disc was pink in color, and the anterior depth was normal. And then once again, I'm going to assess the macula in the right eye. So just look at my light. Okay, so once again, noting that the macula is a nice yellow and oval end shape. So that concludes your head, ears, nose, and throat assessment. Everything was appropriate. No pain or tenderness through any of it then?
Nope.
Okay. All right. Well, thank you for your time and your patience.
Thank you.